Welcome to Dateline Health. This is Fred Lippman coming to you from Nova Southeastern University. And today we're going to talk about something that we have a lot of different comments. We get notes about, there's some of my prescription items seem to be missing out of my medicine chest or handbag or dresser drawer or otherwise. Or what's all this stuff about drug abuse that has to do with regular prescriptions, and are there drugs being sold on the street, et cetera, et cetera. So you had a lot of questions. I figured I'm going to give you the answers with experts, and we got them here. So don't turn away. This is not just about so-called drug addicts and crack addicts or whatever. It has a lot to do with some of the things that are hanging around your house. Let me introduce to you James Hall, who is with the Center for the Study of Prevention and Substance Abuse in Nova Southeastern. Jim, good to see you.
Dr. Lippman, happy to be here.
Good to see you. I mean, Jim is if I can I'll call you Jim. Jim Hall is one of the real pioneer heroes, as I would say, in the Army against the issue of alcohol and substance abuse in our communities, and he's led the advocacy corps and one of the leaders for so many years that I'm very proud that we're here sitting with you, Jim. Thank you.
Well, you give me too much credit. What I've been fortunate to do is to work with really wonderful communities here in South Florida, and particularly our anti-drug coalitions, such as the United Way of Broward County's Commission on Substance Abuse, which is a community partner with our center here at Nova, along with the Department of Children and Families. And those coalitions, as well as the Miami Coalition for a Safe and Drug-Free Community in Miami-Dade, have really been at the forefront of turning what was really the drug capital of the world back 20, 30 years ago into now really some models of approaches to deal with substance abuse at the community level. Unfortunately, we still got lots of problems to deal with.
So let me just stop you right there, because my utter respect for you, you got you in the way of my introduction of our other guest. But our other guest is very well known to us here at Nova Southeastern University. This is Raymond Ferrero III. He's an attorney, and he's an assistant professor at Nova Southeastern University's College of Medicine. And he's our director of addiction recovery. You are the director of addiction recovery legal services.
Correct.
Isn't that right?
That's correct. And it's
Raymond,
a pleasure being here.
Good to see you.
Always good to see you.
Nice to have you here. It's always a pleasure, and you play such a vital role, really, not only at the College of Medicine, but throughout the Health Professions Division, sure, because you're involved with many of the things that we deal with on drug screening. You give us advice, and a good deal of consent, often, as to what our programmatic responsibilities are. So we thank you very much.
You're welcome. And it's also been a pleasure to use this information and use NSU to assist me in my work also with Broward County and the 17th Judicial Circuit, where we do a lot of work with substance abuse within the court systems.
Right. Well, like I said, folks, we got two experts here. Let's talk, and let's, I guess we were sort of, in a sense, reminiscing, but maybe that's not the proper term. We were doing some retrospective thoughts on the past. Alcohol and drug abuse, but primarily the public out here views them as separate entities. But in the drug abuse world, we've always known since the 60s, we talk about the peace and love times and the Vietnam era and whatever, but the illegal street drugs that appeared, and they've always been around. I mean, you go back to the 20s and the 30s and the 40s, there were always the cocaine and the other anodynes, the morphine addicts, the heroin addicts were around for a long period of time, always associated with various professions, but it became so dominant in the world of communication through the press, the television media, and otherwise, particularly the post-Vietnam era, not to in any way point to those wonderful people who served us in the Vietnam era, but there were so many street products out there, so many involved issues with dealing with the addicts, that were causing crime and devastation of a good part of our community culture. Jim, let's talk about that for a while.
Well, certainly that was an era when substance abuse really made a significant change. In other words, it went from a problem that had been around for many decades, but had really not been of a very large proportion. And what we start to see beginning in the 60s and then in the 70s is a dramatic increase in the number of people who are involved in using illicit substances. And it's almost an attitude issue that drugs are okay. And that led us first from marijuana, then into experimentation with other psychedelic drugs, LSD, and then before we know it, here comes cocaine. And in the 70s, cocaine, as it first arrives back in the United States after a couple decades of being away, it turns out that it's perceived as relatively safe. It's non-addictive. And of course, it's become the scourge, particularly in South Florida, of the illicit drugs in terms of the deaths it's caused, in terms of the addiction cases. We still, unfortunately, remain the cocaine capital of the country, with the highest proportion of our drug-related consequences being associated with cocaine. So it was kind of a folly period when we were fighting about politics, but very confused about substance use and abuse at that time. Today, we are still faced with some of those very same issues. One of the things is we know a lot more about it today, and hopefully society knows a lot more about it. And one of the issues that we really have been focusing on in this new century is the important role of early alcohol use in leading literally to careers of drug addiction and abuse. We now know that a young person who initiates alcohol use by the age of 13 has a almost 1 in 2 chance of having a lifelong alcohol dependency problem in their adult life. And so it's that early initiation that is really so critical. And as we're airing this broadcast, we're a part of a national campaign that's going on now looking at underage drinking. And our key message, first, is not to youth, but it's to adults. We really need to change our attitudes and understanding about this really critical issue that really foreshadows so many other drug problems. And I think Ray probably sees a lot of that in his work.
Yeah, I was going to call you Dr. Ferrero, but in my mind, I've already made him a doctor.
That's right.
But Raymond, tell us, because you're seeing, unfortunately, the other end, or I should say, the midpoint. You're seeing where a lot of these young people are get themselves into trouble.
Yes.
They might have caused some kind of mischievous act, what I call status offenders, or maybe even some a criminal act of some sort.
Sure.
And they end up in the court system, and you are dedicated to try to do what?
Well, I've been actually very lucky. I've done a lot of work in the criminal defense area, and oftentimes dealing with juveniles who are getting involved in crimes, whether that be against property or person. And I found it extremely discouraging. And the reason for that was that I didn't feel that I could do enough. So I actually moved more into the civil arena, whereby family members could get involved much earlier on a non-criminal basis and file petitions to go forward and seek substance abuse services for adolescents, adults, the elderly, early, before you actually get into the criminal system. And obviously, as substance abuse progresses, there are